The Hard Truth Season 8 with Akosua Konadu, proudly brought to you by EcoBank.
One of the main challenges of the NHIS is the claims, and now we're here, which I think is fantastic that you've been able to, reclaim 110 million Ghana cedis. Let's look at this. I mean, I know that 20% of your activities are computerized, biometric and all. You have a system like that, but why don't you, NHIS and your stakeholder, the health centers, have a computerized system, 100% computerized systems to fast track, the checking, because these guys go to the hospitals, take huge months or number of months just looking through documents and books just to correct things. I mean, how are you going to fix it?
Well, I mean, part of it is our state of development as a country. But you would agree with me that since the NHIS came, we have actually catalyzed IT in the health system. The NHIS, with all our challenges, are able to issue your ID card when everything is working within 15 minutes. We have surmounted the challenges in card issuance. Now the next step we are going to take is to actually computerize a lot of our operations and let one system talk to the other. Now, but that is only without. Let us look at the investments that are made in IT. We have close to 2,000 CHIPS compounds, I believe, and these are in very remote areas. How do you serve them with IT? We have to look at other alternatives, such as mobile health or use of mobile telephony, to reach them.
I'm talking about these health centers or wherever they go to check. People bring false claims. You want to check to see if it's Halley's or not. So they go to, say, Rage Hospital. They check, okay, this is true, this is not, and all. And it's like manual. How do we fast track is what I'm asking.
Well, you'd have seen what we're already doing. We've started an e-claim system. We have about 52 facilities already enrolled. And these are 52 big ticket facilities. The facilities that submit our big claims, they are all on e-claims. About 10% of the payments that we make go to these facilities. By the end of next year, we anticipate about 160. We select based on the volume of claims and also the risk of making errors in these volumes of claims. But then there is the other side. The health facility has to be ready. You have health facilities that are not IT ready. They are not networked in the operations. The NHIS cannot resource health facilities to get computerized.
Why is that?
How can we
delay the mode of payment,
yes,
because you have to take months.
But I cannot take tax money and give it to a private provider to set up an IT system. What I can do is to enable a system that allows that person to interface with the National Health Insurance System. And we're already doing that. When it comes to e-claims, the benefit in there is that the providers get paid quicker. Or at least that's our plan. Typically, an e-claims...
not quick enough anyway.
Well, an e-claims provider is paid typically 1 month ahead of other providers. Firstly, because an e-claim takes a second to register in our system, okay? The e-claims face the similar challenges of delays in reimbursements, which are not because the system cannot verify, but it's because of what we've said are the payment challenges that we've had over the period. Now, coming back to it again, we would wish that everything were computerized.
So do you talk to them? Do you,
yes,
you urge them to?
Yes, we do urge at every time that we can. But remember that it takes, investment. And that investment, we encourage the private sector to make it, as well as government hospitals. A lot of them have done it. Komfuanochi Teaching Hospital, Kolebu, Tamale Teaching Hospital, as some other regional hospitals, and some private providers have actually invested in it. It's good. It's a good investment. Not only that is it sensible for the NHIS, it is sensible for the providers themselves, because when you computerize, you are able to optimize data capture, analysis, and so on.
True.
So the benefits are all over.
So, I mean, it's not okay to just recoup 100 million Ghana cedis and be excited. Aren't you going to punish those who ballooned the budgets, and what are you going to do to them?
We have, when we do clinical audits, and I think that's what you're talking about, together with claims vetting, you find things that are errors. If somebody writes paracetamol, let me just use that example, and puts a price of 100 cedis, there is obviously an error. And so when we adjudicate, we have to take those ones out, okay? Because ordinarily they would have been paid for if we didn't vet. And so all those things we do to make sure the prices are right, the diagnosis is right. If you came in with a disease or a condition and some other prescriptions were given which don't match it, we don't pay. Now, on top of that, we go to the facilities after the fact to inspect patient folders, to check whether we are billed right, whether the procedures that were used were right, and so on. It is the collection of all these that I believe made the headlines that we have saved 100 and something million. It is, I believe, part of it is due to hard work and innovation, which we started typically, I think, in 2010 with clinical audits, but also with the claims vetting centers, where we have a lot more experienced people than we had in the past.
Nathaniel, you are talking like it's fine. I mean, put in 100 Ghana cedis, we just come and bring our audit and then we reduce to 10 Ghana cedis, it's okay. What are you doing? I mean, someone will go somewhere. What would you do to them so it doesn't repeat again? If it's 10 cedis, it's 10 cedis.
If it's 10 cedis, it might not be 10 cedis, because I won't control the person writing it out there.
So he writes 100 cedis?
Well, I'm going to say, if a claim is coming,
yes,
we don't fill it. Somebody else does. And if they put 100 cedis, I have no way of holding their hand to write the right amount. So, some come with errors. We correct the errors and we tell the providers what it is. But when it comes to pure fraud, we do take steps. I'm sure you've seen in the newspapers, you've heard in the media some of the steps we've taken.
Please tell us, what steps have you taken?
We have arrested, we made a complaint to the police. They have arrested and investigating a healthcare provider in the western region. There was another one in the Ashanti region that came in the papers 3-4 months ago. We have other situations. We have cases being prosecuted in the Sekendi High Court, in other places. Health fraud is a very difficult thing that attends not only insurance but health all over the world. And we can only try to come up to the level where we can detect it early and prevent it. There is another aspect of it that we do, and that is where we're going to go next, is going on the contract that we have with the healthcare providers and taking action as is required, under the contract. And it is that if you do not bill correctly, consistently, then it means you can't work with us, because it makes our work a little more difficult. But I think sometimes it's also because some people do not have the knowledge. And therefore, it is not only sanction, but also to look at how to educate people to do the right thing. Now, if you take our medicines list, if you take our procedures and guidelines, there are many. And sometimes people leave the healthcare facility whom you have trained, a new one comes in, they are not trained. All those challenges are there. So we have to look at this holistically.
We'll be right back. Please stay on.
The Hard Truth Season 8 with Akosua Konadu, proudly brought to you by EcoBank.
At EcoBank, we see a great future, one that's full of opportunity for those who want to be the best. With over 1,000 branches of a single bank across 33 African countries. It's a future where trade can flourish without boundaries. The future is breathtaking, with enormous cross-border investments helping business and government build new infrastructure, while individuals achieve their ambitions right across Africa. The future is Pan-African, and EcoBank is the Pan-African bank.
You're still watching The Hard Truth, and new boss NHIS Nathaniel Otoo is still here. Nathaniel, Dr. Asante Wuku of the University of Cape Coast Medical School, called that the NHIS should include viral hepatitis because it's expensive and all. I mean, looking at the challenges we have and all that, do you think it's a prudent call, this?
Well, that is one of the challenges we have, how we add new treatments to the NHIS system. In other countries, such as the UK, you have an institution called NICE International, National Institution for Clinical Excellence. Their only work is to actually advise their government on what should be put on the list and what treatments are applicable and good to use. We do not have such a system in Ghana, but fortunately, we are growing. We have 2 systems that we use currently. We have a committee or a team for developing what we call the standard treatment guidelines, and we have another one for empaneling the essential medicines of the country. When Dr. Otoo has said that, I think and I believe it should go through those steps for us to see, one, the feasibility. You see, when we look at adding diseases and conditions, what we should not forget is that everything is paid for. And since you have a pot of money, it means prioritizing. So does it mean that when we put that on, something else goes off? Those are all issues that we have to look at. But we believe that in the coming year, we'll make recommendations for how to do these things properly. There is a clamor for everything to be included on the NHIS. I mean, currently by law, we are going to include family planning services. People are, clamoring.
What about childhood cancers?
I believe, as a person, I believe it is not fair not to include childhood cancers because the recovery rates are good.
Yeah.
And in our next review, we are going to look at that. And so, yes.
Now, you are challenging the health centers to improve on quality. Now, this is a case, the numbers just overwhelming. So how do we have overwhelming numbers and then quality? Does it go hand in hand to me?
Well, I hope you're talking about the system as exists and not what crisis we are in currently. Healthcare quality affects everybody. But as you know, the NHIS, we buy services on behalf of our members. And it is our pleasure and it is our wish that our members will get good quality services. But what we call quality is contextual. It is contextual based on the Ghanaian system and the Ghanaian context, but also it is situated in a world-class system where certain things have to be the case. When we talk about quality, it means a lot of things. On the surface, there are 2 aspects. There's what we call the perceived quality and the technical quality. The perceived quality is what the patient thinks they are getting as a quality of service. It might include whether they are treated with respect at the facility and so on, how good are the washrooms and so on and so forth. But on the technical side, a lot of it is not known to the patient because the patient does not have that much technical knowledge. It is that area where policies of the ministry seeks to address, in addition to also addressing the issues of technical quality. Now, when it comes to technical quality, the Ghana Health Service, which has been mandated to actually set quality standards, has a quality framework. We do engage with them, and what we do as the NHIS is when we visit the facilities, when we vet claims, we make observations on how people have been treated, and we feed that back for improvement.
By you or sitting back and watching, I mean, how do you make observations?
Well, you see, in the work that we do, every organization has its role. Ours is a financing role. The Ghana Health Service and all the health providers are a provision role. The ministries is a governance and supervision role, and the member is actually a feedback role. So they feedback, and also they should do the right things. When they are treated and told to do A or B or C, they should do it. Now, if all of us play our role properly, everything will be okay. If we have problems with, fulfilling our roles, which we do all have, then the system has challenges. Now, on our part, we are trying to fix the funding challenge. On the part of the providers governed by the ministry, they will also try to attempt to deal with the quality challenge. And when we talk about quality, it comes in different dimensions, okay? Now, sometimes something that happens at a healthcare facility, though it is very simple to correct, might have a big impact. So, if there are medicines in, say, a cabinet, which a doctor only should dispense, some of the simple things that can be done is to tag it with a color. So when the nurse goes to pick it up, she might not pick up the wrong one. Those that the nurse can dispense can also be tagged with a color. You know, those that are dangerous. So all those things, they do not cost a lot of money. But the experience shows that when you do it, it actually improves, you know, people's outcomes.
But is there like a training session for them do this and put this here and all?
What I do know is that the Ghana Health Service and the ministry are actually very interested in getting quality to the fore. And I do know that the Ghana Health Service has what they call the ICD Directorate, the Institutional Care Directorate of the Ministry of the Ghana Health Service. Mm-hmm. They define the protocols, they do the monitoring evaluations, they do the follow-ups.
Let's talk about NHIS. I mean, it's nice the things we are talking about, and then we are doing this, and there are lots of people coming on the scheme, but frankly, does the card work? Does it work?
I started my entire presentation by saying that we have challenges. And if I start by saying so...
It's different to have challenges?
Just one moment.
Okay.
If I say so, I do not start with glamour. I start with reality. Are our members happy with all our services? My answer is no. And what are those that they are not happy with? And when I talk our members, I also talk about our stakeholders. Delays in payment to healthcare providers is something that causes us a lot of problems and causes the healthcare providers problems. We think it is time to deal with this holistically. And dealing with it has a number of dimensions. It might mean more money, but it also might mean better efficiencies. And better efficiencies come in many ways. I'll give you a typical example. Last week, we took a tour of Greater Accra region. And when we took a tour, it just dawned on us that one of the steps in our registration process can be conveniently removed. When a member faces our officers at the scheme or the district,
right,
we fill paper forms, you know, for their membership enrollment and pass it on to a registration agent who feeds it into the computer. By just cutting that step, okay, you are going to be able to save on paper utilization. And you can imagine the scale. 10.5 million registrations in a year, all going through paper. What that does, it frees some money to do other things. And also it's going to free our staff hours. And so what we were discussing prior to this is, what are we going to do with the staff who are freed from filling these forms? Our plan
is at NHIS level.
Yes.
We are card holders. We feel the card doesn't work or it's not working. What are you doing, sir, to make sure when I go to the hospital as a card holder, I go, I get treatment, I get my medicine, and then I'm happy, oh, card, and then everybody is a win-win for us all.
You did not wait for me to finish.
I'm listening.
When those staff of mine are freed, I'm going to deploy them to the health centers, as you call them, or health facilities. What has happened over the years is that our members go to the health facilities and they are left without direction. They get there, they are told anything, and they don't have anybody to go to. Now, what we want to do is to train our staff and let them be present. First of all, to deal with issues of when members come in, to get them to know how to go through the system, but to take also complaints on site so that we can deal with them.
But how do we even identify these people?
Our members?
Exactly.
Our members.
How do we identify them? I'm a card holder, I've gone to the hospital, and then how do we identify a member of our Ghana Health Insurance?
Oh, well, as I said, we'll set up a desk. It will be branded and identified. And we'll use your medium to educate the public when the time comes, that when you go, it should be your first point of call. Such that, you know, we'll start the treatment process or your attendance process from there, right through to when you get the service.
Okay.
That is not the only thing. You talked about medicines. It is indeed a challenge. What has happened to medicines? The price has escalated so seriously over a very short term. We set our medicine prices last year around February, and before long it was overtaken by the turn of events, because most of our medicines and their components are imported. So if the US dollar goes up, the prices also go up. Sometimes the price increases are quicker than our cycles of review. By law, our cycle of review is 1 year. Practically, I think sometimes the prices catch up with the review, and we might have to look at things a lot more. But then it also comes to the issue of how do we procure medicines in the country, and how do we use economies of scale? Now, the NHIS as a singular organization makes it possible for about 10.5 million people to have access to healthcare. That is a negotiation muscle that we have to actually get better prices for the medicines we have. Fortunately, we made a lot of representations, and the Ministry of Health has seen the need to review the entire medicine supply chain system and set up a new system. That is being worked at right now. We also have started engaging with some selected pharmaceutical service providers. You see, when it comes to pharmaceutical pricing, it's a function of many things. The pharmaceutical companies will price medicines based on the profile of a country and of a single institution to be able to procure. We happen to facilitate the procurement of a lot of medicines, and so they think it is now time to talk to us, and we have started talking. We've had some modest achievements. We've had some pharmaceutical companies drop their prices because the NHIS has come in. It is not all over the place, but these are minor achievements that we've had in the process. We want to deepen them. Again, when you look at pharmaceutical products, we don't produce a lot in Ghana. They are mostly imported. Even the raw materials for producing those locally here in Ghana are also imported. So we're import dependent in that sector.
The Hard Truth Season 8 with Akosua Konadu. Proudly brought to you by EcoBank.
EcoBank, we see a great future, one that's full of opportunity for those who want to be the best. With over 1,000 branches of a single bank across 33 African countries, it's a future where trade can flourish without boundaries. The future is breathtaking, with enormous cross-border investments helping business and government build new infrastructure, while individuals achieve their ambitions right across Africa. The future is Pan-African, and EcoBank is the Pan-African bank.
You are so confident, and then you want Ghana to trust that Nathaniel Otoo is in office and NHIS will be better. Should we trust that you being here now, things will be better?
That would be an utopia. I can do my bit within my capacity and within the constraints that I have to make the best out of the situation that we are in. If I promise you it's going to be ideal, I'll be lying to you. It will not be ideal. We will have challenges. The important thing is to identify them and find ways of dealing with them.
Can we sustain NHIS, sir?
I believe that the NHIS is one of the most important social interventions, and from what I see and the support that I get, there is every intention to make the NHIS sustainable.
What's new at NHIS? Tell us. What should we be proud of when we hear NHIS?
Well, what is interesting right now is that we do understand the need to engage with our stakeholders. A lot of the time, there's been strife, there's been confrontation between us, but the issues that confront us are normal. And they are actually,
really?
When I say normal, yes, every system has a finite set of resources. And what we do is, within that set of resources, what do we do? And that is why we continually have to engage. The second thing is that when it comes to our members, who essentially are patients at healthcare facilities, there is a lot of information that they don't have. What we want to do is to place information in the hands of our subscribers so that they would know what they're entitled to. Today, if I asked you whether a medicine was on the list, you might not know because it will be listed by its generic name. I don't know all the generic names, but that is what the law says we should do. And let me touch on this issue of generic medicines. The refrain out there is that generic medicines are bad. My answer is that generic medicines are not necessarily bad. Generic medicines only describe medicines that are out of patent. That's all it is. And so the name generic medicine is not synonymous with bad quality, but it's synonymous with a medicine that is out of patent, which means that if I had a pharmaceutical company that developed medicine X or Y, The World Trade System rules say that for 20 years, I have the exclusive right to manufacture those products. After 20 years, anybody else in the world can manufacture them. And so there are medicines that have gone past their 20 years of exclusive rights to the developer. Those are the ones that we call generic medicines.
So at the end of this year, what would Ghana be proud of when it comes to NHIS? What's happening? Tell me this at this point. This is happening.
I'll tell you three things that are happening. I'm telling you about better stakeholder management and engagement. I'm telling you about our members having better service by way of information and complaints avenues. And I'm going to surprise you, but I'm going to tell you that by the end of the year, we are going to have a system of looking at what we have, looking at what are the shortfalls, and make recommendations for its improvement. Now, the NHIS is one that connects many things. The Food and Drugs Authority's work impinges on the NHIS. The Ghana Health Services, work impinges on us. The Medical and Dental Council. It is multifaceted. And at this point, we are going to look at how everything inputs into the system and come up with a blueprint of how we can do things better. It will include how do we finance the NHIS better.
So, as a card holder, if I face challenges at home, is there like a number to call to reach out, or I just have to come to the the head office, or where do I go?
As I said, the best thing would have been to have a person on site that you complain to. But in the absence of that, and as I said, we are trying to address that, we have a call center. Most people call into our call center, and where there is things that we can do for you immediately, we do that. Okay,
so the number to call if you are in distress, want to call National Health Insurance Scheme or the authority, you can call them on 0544446447. Again, 054444, a lot of 6447. Nathaniel, thank you so much for talking to the hard truth. Thank you. So, new boss NHIA, Mr. Nathaniel Otoo, and my name is Nana Akosua Konadu, and this is The Hard Truth. And Valerie, thank you. Reflex Images, thank you. If you want a complete video of this episode, check it out on our Facebook page. That's The Hard Truth on Facebook. Good evening.
The Hard Truth Season 8 with Akosua Konadu, proudly brought to you by EcoBank.